Miracle study is a phase 2 study of MRD-guided time-limited therapy for patients with previously untreated CLL with Pirtobrutinib and venetoclax. So this is a trial using a non-covalent BTK inhibitor, Pirtobrutinib, in combination with the BCL2 inhibitor, venetoclax. We know there's a strong interest in the field of CLL to use combination strategies in the front line using BTK inhibitor and venetoclax. There are a number of studies that are ongoing testing different non-covalent BTK inhibitors with venetoclax, and the results are certainly promising. In this study, we're using the new BTK inhibitor, which is Pirtobrutinib, and which binds BTK in a non-covalent fashion. In the Brewing study, this medication demonstrated very high efficacy in CLL patients that have been previously treated, including those with BTK inhibitor, venetoclax, and so on. And so in our study, we're going to use an MRD-guided strategy to direct the duration of treatment. So in the ongoing trials with other BTK inhibitors and venetoclax, most of the time the duration of treatment was arbitrarily determined before starting the treatment. So we're going to learn whether a MRD-directed strategy will be feasible and generate high efficacy in this study. So in this end, patients will be started on Pirtobrutinib for a total of 3 cycles as a debulking strategy to lower risk of TLS. Then we add venetoclax, and then we treat the patient for a minimum of 12 cycles, but a max of 24 cycles of combination. Along the way, we check the MRD status in the peripheral blood and bone marrow using the clonoSEQ assay. So then at 12 cycles of combination, which is the end of 15 cycles of total treatment, if the patient have undetectable MRD in both peripheral blood and bone marrow, they can discontinue treatment. If they still have MRD detectable, well, then we can continue treatment, and then we'll check again at the end of cycle 21. And similarly, if they have undetectable MRD status, they can discontinue treatment. Otherwise, they will continue treatment until cycle 27, and then at that point, everybody will stop treatment, being this a time-limited intention of treatment. MRD is an important endpoint when we give time-limited therapy using venetoclax-based combination therapies. We now have accumulating data to show that MRD is an important endpoint. Patients who have undetectable MRD status will do better in terms of subsequent progression-free survival and even overall survival in some cases compared to those who still have detectable MRD. So in other words, achieving undetectable MRD is a very important milestone when we give time-limited, highly effective therapy. Again, what's the optimal duration of therapy to get there? And whether MRD status can guide the discontinuation of therapy still require more studies. We hope our study will add some insights in this perspective.